Hi, this is Dr. Chindan Patel again, coming in from CVIS here in Tucson, Arizona. I'm privileged here to have Dr. Neil Gheewala, one of the co-hosts for the CVIS conference here, and one of the partners for U.S. Heart and Vascular here in Tucson, Arizona. Thank you, Neil, for joining us today. Neil, you are a jack of all trades. You're doing complex interventions, you're doing structural heart, you're raising two beautiful kids, and you're also running the day-to-day business and trying to grow an amazing practice. On top of that, you're very personable and a guy that anybody can kind of approach. And so, if I'm a fellow looking for a job and I see you at a conference and I'm going to come up to you and say, how do I find a job? What's the next step for me? What's some advice you can give a fellow when looking for that job search and trying to find what their next career path is?
It's a great, first of all, thank you for having me. I mean, and being at this wonderful conference. I think that fellows in training have a lot of options, right? And at the end of the day, I think it's most important to say, what do you want to do, right? And I think the first 2 to 5 years out in practice, you need mentorship. You got to go somewhere where you find somebody that's willing to work with you, who's willing to back you up in cases, who can serve as a pseudo mentor for you, right? And I would say that some of your mentors that you have in practice, maybe even more powerful than some of the mentors we had, in residency and fellowship, right? So I think that's key number one, right? So obviously a few different settings, right? There's academic, there's employed settings, and then there's private practice, right? And I would say that all of those options have great merit. Every one of those options has great strengths and great and some differences as well, right? In academics, I mean, the nice thing is that if you're into education, you want to train residents and fellows, if you would like to apply for grants and do bench research, I think it's a fantastic way to get involved. In an academic or an employed setting, many of those settings also do have the opportunity for education, right? Which I think gives a lot of satisfaction to people in their career. But I think that there is a lot of opportunity that isn't talked about in the what I call the private world that you can build to create an academic setting, right? Building large clinical trials partner, right? So your relationships with industry partners, right, who sponsor, new pharmacologics and also new devices, right? Those are really powerful sponsors to build a relationship with that can bring you trials and for you to be investigator of. And obviously, if you're doing good science and rolling well, gives you an opportunity to get published, just being in a non-academic setting, right? So there are options out there, but I think the fellows just have to know that I think, it's been said earlier at this conference, there's the will, there's a way. So there's no such thing as a closed door, especially in the cardiology field.
That's amazing. And, being in a private practice world, obviously most of us are trained in some academic kind of setting. And so private practice has always been one of these nebulous things that we're not sure about. But here you are in a private practice and your relationship with such a strong hospital like Tucson Medical Center, who's also been helpful to co-host this and allow you to be innovative and to be able to expand your care for so many people. As an individual provider, what have you done or what advice could you give to help foster that relationship with the hospital so that you can take it to the next level?
That's right. I think it's a partnership at the end of the day, right? And we're very lucky to have several great partners here in the city, TMC being one of them. And I think at the end of the day, you have to, as a private practice, understand what the needs of both entities are, right? As a practice, we want efficiency. We want to make sure our patients are taken care of. At the hospital, and something that we share in common with the hospitals, and we want high quality. We want our patients taken care of. We want to make sure that there's, a good process for follow up, right? So a lot of that stuff takes collaboration, right? And I think that there is there's a lot of mutual interests to a common end when you work together.
Wonderful. Now, I've been asking this question both on camera and off. You've got a time machine. You go back with all the knowledge you've gotten, you go back to your first year fellow self.
Yeah.
Is there any piece of advice, warning, or anything that you may want to tell the young, not that you're not young Neil now, but you're the younger Neil Gheewala. Yeah. Is there any piece of advice, or what would you tell your younger self if you could go back in time?
I think a big thing is keep an open mind, right? That there's a big world out there, right? And where we train is kind of what we know. But there's a lot of wonderful things being done out in the community, out in academics, right? Out in a hospital employed setting, right? So I think the big thing is keep an open mind and that the world is dynamic healthcare shifting and changing, right? What things look like today may be different than look in 2035, right? So you have to keep an idea that keep an open mind that things are dynamic. So what things look like now, it's one vantage pole, right? Whereas things change, policies change, care models change, right? Your view on that may change, and I think that that's what I would. I've over the last 15 years, that's something I've been humbled by is that how much change things have evolved since I started my cardiology fellowship in 2011 to what they are today.
Absolutely. They always say that by the time you graduate medical school, it'll have already been changed, and that goes beyond just the science of it. It's also the every aspect of healthcare. Well, thank you for joining us. Thank you for a wonderful conference. Again, this is Chintan Patel coming in from CVIS. Look forward to some more great sessions today, and look forward to seeing more people out here next year as well. Thank you.